In Shubham's case, there was anomalous vertebra at D12. So this was D10, this was D11, this was D12, this was L1, this was L2, and the spinal cord is getting severely compressed because of D12 vertebra. Now this condition is called as high angular kyphosis. These are spinal deformities. They are the kyphoscoliosis. One of the ideal investigations is the X-ray, very important, and MRI scan. So if you see here, this is how the X-ray looks. Almost 100 degree of angular kyphosis, where there is an anomalous vertebra of D10, D11, D12, all they are of abnormal shape. But one of the most culprit which is causing the problem is the D12 hemivertebra, anteriorly deficient vertebra, leading to the posterior internal gibbus, which is causing compression over the spinal cord. If you have to see the MRI, this is how the cord is getting buckled, the cord is getting compressed, and these surgeries are challenging surgeries. These surgeries involve a lot of neurological risk. But today, with the experience what we are having of kyphoscoliotic deformity correction, we say that we can correct this by a technique of vertebral column resection. We take out the vertebra in toto, we take out the posterior elements, and we correct this in the form something like this. So if you see here, now these are the vertebrae. This is D10, this is D11, this is D12, this is one vertebral column which is completely taken out, and it has been reconstructed with the help of Harm's mesh titanium cage. These are the lower vertebrae. This is the spinal cord which is now made free, and this vertebral column is supported with the help of posterior pedicle screw construct. This column assembly, what we can see it here, is very well documented on X-ray in this form. So if you see here, this is what we drew, this is what we explained to the patient, that we will do this procedure, and this surgery was performed for Shubham Kashid. Shubham got 3-4 levels of pedicle screw which were ranging from D9, D8, D10, D11. The D12 vertebra completely removed, the anterior column reconstructed with the mesh cage, and the lower 3 vertebrae and the spinal column were reconstructed. This was the follow-up X-ray which was done and which was taken at the end of 1 year, and now this procedure which we have done 1 year back shows a very good sagittal reconstruction and a kyphosis correction on these X-rays. Now we have seen on vertebrae, on the paper models and on the radiographs that how well these vertebral deformities, the kyphosis, can get corrected. Now he is Shubham, whose surgery we have performed 1 year back. One of the most aims of the spinal deformity is we want to give a well balanced, a symmetrical spine. Now if you see him, just turn around. These are his both the shoulders which are very well balanced, and this is his back. He has a very good kyphosis and a lumbar lordosis. His both pelvis is well balanced, and because of which, because the deformity is corrected, he has gained his length or the height by almost 2 inches. He has a growth potential which is remaining. Many people ask after the surgery whether the height will get restricted. After the age of 14, once the skeletal maturity has come, the appendicular skeleton, that is the upper limbs and the lower limbs, grow by 80%, and the vertebral column gives only 20% height to the actual height of person's height. So we tell this person whose family is itself very much short, he is in 10th standard appearing for SSC exams, and now at the end of 1 year he says that he is very happy with his balance correction. We can see on these diagrams what we wanted, what we achieved, and these are the follow-up results at the end of 1 year. I will reiterate again, these kyphoscoliotic deformities, they are the most challenging cases. They involve long hour surgery, expert anesthesia. One of the best setups are required to perform this surgery. But with today's advent of advances in the science and the surgical expertise, what we have achieved over a period of many years, we are able to deliver the good surgical correction and good balance back to kids like Shubham.